Well, it's a pleasure to be here today with Dr. Brueggen. I have him here with me in one of our consultation rooms to answer some questions that we received from a lot of our followers on Facebook. I wanted to thank you all for your questions. Got some great questions today, and Dr. Brueggen will be here to answer them for you. It's been a pleasure being able to chat with all of you on Facebook, and it's really awesome to interact with you every day. Dr. Brueggen, the first question that we received was from Sheila. She was concerned about cosmetics. She had said that she had a short upper gum, some weak bones, and had a forward slant to her teeth. And when she smiled, it doesn't look like she really had teeth. And she's had some procedures done to try and correct this issue. And she wanted to know, can implants correct this issue?
Well, you know, Sheila, is that correct?
Yes, sir.
Sheila, I'm not sure. Implants are support for teeth. And so the implants themselves wouldn't correct it, but it's entirely possible, almost likely, that if we make some effort, that we should be able to provide for you a set of teeth that look beautiful. I can't imagine why you couldn't have teeth made that would give you a beautiful result, and perhaps using the implants to anchor them. So I'd love to meet you and do an exam and see what we can do to help you, Sheila. Okay?
Well, thank you for that answer, Dr. Brueggen.
You bet.
The next question comes from Miss Beatrice. She wanted to know, could I have implants even though I'm diabetic?
Beatrice, absolutely you can. Diabetes is not a contraindication to dental implants. Of course, there's type 1 and type 2. I'm not sure which you are, but it doesn't matter as long as it's controlled. Now, if your diabetes is not controlled, it'd be a contraindication for you having any kind of surgery, including dental implant surgery. So it's just a matter of what your A1C level or your blood sugar levels are. And if they're not in the proper range, then usually it's just a matter of working with your physician and you to get them there, and then you'd be a candidate for a dental implant, okay?
All right, thank you so much.
You bet.
The next question comes from Hyah. She's concerned. She had a 4-tooth bridge that broke off, and when it broke off, the tooth post came out with it.
Yeah.
And so now she has a gap in her upper left gum area. She wanted to know what would the cost of implants be. I'll answer that one for her, but she wants to know, she's a senior and in good health. Would implants be a good option for
her? Well, probably. I can't imagine why they wouldn't be. A bridge breaking off, a tooth coming off with it is a common problem. There's nothing unusual about that at all. Statistically, we usually expect a bridge to last about 10 years, and normally the reason that they fail is because of a broken tooth. So the problem you're experiencing isn't at all unusual, and I'm sure we'd be able to help you. Jacob, can you help us with cost?
Yes, sir. Hyah, it really depends on the condition of your mouth, what the bone quality looks like, and what kind of implants Dr. Brueggen would need to use, and the number of implants it would take to get you to get your procedure completed. And so I could imagine a case like this being anywhere from $7,500 to $10,000 possibly. Of course, we'd have you in for an exam and do a complete examination with Dr. Brueggen, and we could more thoroughly give you an accurate quote after that. The next question comes from Miss Cora. She wants to know, she's diabetic, are implants safe for her, and also she has issues opening her mouth fully. What are your concerns there?
And this is Miss Cora?
Miss Cora.
Miss Cora, you may have heard me just talking about diabetes a moment ago. Diabetes is not a problem as long as it's well controlled. If it isn't, it could be a big problem. It could be not safe at all for you to have any kind of surgery because your healing could be delayed. So that's the story about diabetes. Mouth opening is an issue that we deal with pretty often, more often with folks that have had some type of head and neck cancer radiation, and it can really limit our ability to use the instruments, place the implants. But so far, and you could be the first, I'm not sure, but so far we've never seen a patient whose mouth opening was so limited that we couldn't find a way to help them. So I would suspect you're going to be just fine.
All right, thank you so much. These next couple questions are more about finances, and I'll be more than happy to answer those for you. Miss Sharon asked, how much does one implant cost from start to finish, excluding the crown? On average, most implants range between $2,000 and $2,500. It depends on the type of implant that needs to be used. And so the doctor would evaluate that for me and let me know what kind of implant he would need to use for your procedure. So thank you for your question, Ms. Sharon. Bobby wrote, do you have payment plans for low-income people? Yes, we do. We work with different healthcare credit providers, and it's easy as having a patient come in the office. We sit down, we submit an application, and we can find out what you qualify for almost immediately. And so that's one of the ways we help our patients every day. And so thank you for that question as well. Miss Yolanda asked us if we had a website, and we sure do. You can visit us at www.nodentures.com, and there you'll find tons of information about cost, different types of procedures that we offer, and more information about all-on-4 and dental implants in general. And Miss Latisha asked, what is the cost if you've already had all your teeth taken out? All-on-4, if that's what you're inquiring about, starts at $17,900. And so what we would do is have you into the office, and we would evaluate you and discuss costs more thoroughly once we get a good examination done. All right, Dr. Brueggen, so a couple more questions. Stephen had written, how do you know if you have enough bone quality to have implants placed?
Well, Stephen, enough bone quality, there are two questions there really. Do you have enough bone, and is the quality of the bone good enough? Whether or not you have enough bone is easily determined by a cone beam or a CAT scan. Most people do have enough bone, depending on what kind of implants we're going to use, where we're going to use them, and what we're going to do with them. In my practice, for many years, my focus has been on finding solutions for placement of implants without bone grafting. We can't always do it, but we can do it very often. I see patients all the time that someone's told them that they couldn't have an implant because they didn't have enough bone, and indeed they do. So you probably will. Certainly we can determine that with a CAT scan. Bone quality is a little more difficult, Stephen. CAT scan gives us some clues. We can look at it and have some idea about the density. When we talk about quality, it's how hard is the bone. If it's nice and hard, it'll hold the implant really well. If it's too soft, it may be a little more difficult. But it's rare to find, very rare, to find any issue with bone quality, or quantity for that matter, that can't be handled. So come in and see us, and we'll take a look, and I'm sure we'll be able to find a way to help you, Stephen.
And then Gloria wrote, as a follow-up to that question, will my implant stop bone loss for good?
Well, Gloria, that's a tough question, but it's a really good one. Bone loss, once you lose all of your teeth, Gloria, if you lose a tooth, where the tooth was, where the root of that tooth was, you're going to lose bone there just for the rest of your life. It never stops. And so if you place an AB titanium implant into that area, it has a great opportunity to stop the bone loss. If your bone loss is because of periodontal disease, gum and bone disease, and then you place an AB dental implant and you don't floss and brush and clean it the way that you're supposed to, then you may still have periodontal disease. It won't have anything to do with your implant. It's a gum and bone disease because of inadequate oral hygiene. But the AB dental implant should prevent bone loss. Give you some idea of what bone loss looks like when you lose your teeth. I'll show you. This is a model. I know it's not very pretty, but nonetheless, it's a model of teeth and a lower jawbone. Same thing happens on the upper. This just happens to be a lower. We notice on the upper model that we have teeth, and we notice the length of the jawbone from the bottom of the tooth to the bottom of the jaw. That's a normal, healthy mouth. Here is the same jawbone, probably no more than a year after these teeth are extracted. We can see the distance from here to here and how much shorter it is here. This is perhaps another 5 to 10 years later. We can see it's getting shorter by far than it was here, and even shorter than here. This would be very difficult for you to see, Gloria, but if you could, you would notice that the bone on the top, what we call the ridge, it looks an awful lot like maybe a saw blade. It's really sharp and jagged and very, very thin. This will be the next layer of bone to go away. This is a jaw where the teeth have been missing for probably quite a number of years, maybe 15 or 20. Kind of common to see this if a patient has been wearing dentures. If, after these teeth were removed, an implant had been placed here, 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 and here, and they'd been well taken care of, then it's likely that we would never see it go from here to here. So, Gloria, I hope that answers your questions. Awfully long answer to a relatively brief question, but it's a very good one. Thank you for asking that, Gloria.
Right. So Michael asked next, if I have these teeth placed and I get this work done, what's the long-term maintenance going forward?
Michael, it's a little bit like I just told Gloria. It's very similar to natural teeth. When you have an implant is just a man-made root, very similar to the root of a natural tooth. And just like with natural teeth, you need to brush it a couple of times every day and do a really good job. You need to floss it every day, once is plenty, and you need to water pick after you eat meals if it's a restoration, if it's teeth built on top of the implant that creates a space. If you have one tooth replaced with one implant, then water picking is usually of no benefit. But if you have a full set of teeth built on top of implant, then the water picking is very important. But always the brushing and flossing. Hope that helps.
Christine asks, what are the chances that my body would actually reject the implant because it's a foreign object?
Well, not very high, Christine. The great news is the AB dental implants are made out of titanium. It's what we call an inert material, so the body tends to have no rejection of it whatsoever. So the likelihood of it being rejected is probably almost none. The likelihood that for one reason or another that implant won't be, we'll say, accepted by the bone is about 2% on the upper and about 0.5% on the lower. When that happens, typically you can just remove that implant, put another one in, and it usually takes care of it.
Dr. Brueggen, our next question comes from Greg. He wants to know if my teeth do break, if I have a breakage, how do I go about getting it fixed?
Well, Greg, it depends. They don't break very often, but the truth is that's really what we see most often with implants. The titanium implants that are made by AB Dental, they're almost bulletproof. We don't see a lot go on with those. So when we do see an issue, it's usually with the teeth that we build on top of them. A single implant placed to replace a single tooth with a single crown built on top of it, it almost never happens. Every now and then, one of them will dislodge. You come in, we glue it back on for you, and you do great. And that doesn't happen very often either. If you're unfortunate and you've lost all your teeth, and you've had to have, say, an all-on-4 appliance done where we've replaced all the teeth with a set of new teeth, well then breakage is a little more common. Still not something that we have to deal with all the time, but it's more common. If that happens, then you come into the office. We have an on-site laboratory. They repair it for you while you wait. You leave and everything is taken care of. So I don't see many problems with it. You should do fine.
Our last question comes from Catherine. She wants to know, she's been looking online and at different places, and she sees other offices in other countries, other states offering all-on-4, and wants to know if it's advisable for her to travel a great distance to have the procedure done.
Well, Jacob, this is Catherine?
This is Catherine.
Did Catherine indicate, did she have any reason for why she might want to consider going somewhere far away to do it?
She mentioned that in other countries it could be significantly cheaper.
Ah, okay. Catherine, that's a great question, too. The problem with traveling to do significant dentistry like this, and I see it every now and then here where someone comes to see me that's had something done maybe in another state or even another country, is that things can happen. Unfortunately, even though they don't happen often, they do happen. Perhaps you have an all-on-4 done, and you've had it done in another state, and you come home, and a tooth breaks. Just a simple tooth, something that if you were here, and I had done it for you, you would come in, and in an hour or two, it would be taken care of in our on-site laboratory, and you'd go home, you'd be great. Well, now it's broken, and perhaps you have to fly all the way to another state, or worse yet, to another country, to get a simple little repair like that done. And of course, if it's one of your front teeth, that's a major, major issue for you. And worse yet, if it's the entire appliance that breaks in between your implants, then your implants are at great jeopardy of being lost, and you're going to be worse off than when you started. So the most common problem that I see with that are these complications that can occur, and then how incredibly difficult it is for you to get them taken care of. So I normally don't recommend that. I rarely see that any cost savings would be worth your while in the long run. So I would certainly discourage you most of the times from doing that. Okay?